under pneumonia, we are going to deal with the typical. So we have the typical pneumonia as well as the atypical. So these two varieties of pneumonia we're going to discuss. So firstly, we'll focus on mainly the typical. So under typical, we need to know that it is by the extracellular organism. It is by the extracellular organism. And next, it is the alveolar exudates in the air spaces. It is the alveolar. So it is the alveolar exudates, and this is in the air space. This. Next, it is a neutrophilic in nature. It is nothing but neutrophilic in nature, and it presents with a high grade fever. This high grade fever. So these are the points. Next, we will look at there is also characteristic productive cough. There is the productive cough which is seen, as well as there is presence of the pleuritic. This pleuritic chest pain, and there is also presence of the X-ray shows. So the X-ray, if you see, what it shows is a large areas of consolidation. Those large areas of consolidation. So there's large areas of the consolidation. So this was about the typical pneumonia. Now we'll be looking at the other category, that is known as the atypical. So the atypical pneumonia. So under the atypical pneumonia, we need to know it is by the intracellular. It is by the intracellular organism, and it is the interstitial. There is a interstitial involvement. And other thing to note is that it is lymphatic. It is lymphocytic in nature. Whereas the typical one was a neutrophilic in nature, this is lymphocytic in nature. And in atypical, it was an intracellular organism, whereas in typical, it was an extracellular organism. So now to continue, this is a low grade fever. So in atypical, it is low grade fever, whereas in typical, it was a high grade fever. And now we saw the typical had a cough. There is a very productive cough, whereas in case of atypical. So in atypical, there is cough, and this is a characteristic dry cough. So in atypical, there is a dry cough, whereas in typical, it was a productive cough. So there is dry cough hemoptysis as well. So this is a dry cough hemoptysis, and this is with a scanty sputum. So this scanty sputum. And there is an extra pulmonary manifestation. There is a extra pulmonary manifestation. There is an extra pulmonary manifestation. And when we look at the X-ray, so when we look at the X-ray, it shows an interstitial pattern of involvement. So interstitial. So it is interstitial pattern of involvement. So this was about pneumonia and the types, that is typical and the atypical. So we compared both of them. And to learn and grow daily like this, please do subscribe.